The ATTU, the Air Transportable Treatment Unit, is a new capability for the Afghan National Army. They will actually be able to push surgical care further forward on the battlefield, closer to within that hour, that golden hour of care. So we spent a total of 5 days this week. The first day we actually taught how to tear down and set up the tents. The next 2 days were spent going over the various pieces of medical equipment inside the ATTU. Days 4 and 5 were spent setting up the entire ATTU for them to prepare to see patients in the mass casualty exercise, where they actually saw and exercised how they would triage the patients and how the patients would flow through the ATTU.
We want to show for our trainers how we triage the patients, care the patients like a real casualty. It's like a real casualty that we can show our experience here. The doctors there will be in the future like trainers. They now get training. After that, they will train the other peoples.
As the patients came in from mass casualty, they would evaluate each of the patients depending on what category they would fall into: delayed, minimal, expectant, urgent. After the first stage of the triage station, they would actually bring in the patients according to their need into the first tent, the first treatment, and further triage from the physicians that were manning that section of the tent. Those that were the most urgent, that required immediate care in the operating room, were sent back to the second tent where the operating room was established.
It's a mobile clinic. We can deploy this in some area that's far from the regional hospitals. We can do some life-saving procedures there, and we can reduce the mortality rate in the soldiers.
So there are a total of 8 ATTUs that the Afghan National Army has. 2 of the ATTUs actually will be within the National Military Hospital and the Armed Forces Academy of Medical Sciences. One of them will be strictly used for training purposes, and the second will be pre-positioned for use in response to a natural disaster. The remaining 6 are actually being pushed out to the regional locations, primarily focused on those areas of the country where they have a lot of kinetic type injuries, pushing forward this surgical capability far forward in the battlefield.
Everyone is proud to be like a trainer here. Every corps will send their personnel here, and we will train them, and they will go back with their ATTU packs. I hope that will be useful for our army.
The train-the-trainer concept that we've taken place this week is we've invested time in those trainers located here in Kabul at the National Military Hospital and the Armed Forces Academy of Medical Sciences so that they can turn around and train the regional trainers. ATTU team members from the regions will come to Kabul and spend 7 days training on the equipment, receiving lectures ranging from security to communication to use of the equipment, and again culminating with the mass casualty event.